What do you know about diabetes mellitus type 2? Today, you will meet Mary.
Being a senior accountant, she was always on her desk doing paperwork, causing her eyes to fail. She led a sedentary lifestyle and did not care much about her health. This is where Mary's life went downhill. She would devour fatty and sugary food without considering their ill effect. Pizza, burger, chocolate, ice cream, pasta, and gelatos were her go-to meals. Even on her free time, she wouldn't bother doing even the most minimal exercise and would lay down on the couch all day, watching movies. Sedentary lifestyle at work and at home is what contributed to Mary's current dilemma. Mary noticed how often she would get headaches and would easily get tired and dizzy even during the day. She always felt hungry and thirsty, even after a huge meal. She felt as if her cravings were far from being satisfied all the time. Weight was another issue Mary was concerned about, as she had been gaining heaps of weight for the past year. Notwithstanding the fact that she was already obese, based on her BMI of 35, she continuously engaged in an unhealthy lifestyle. One night, after having a relaxing shower, Mary tripped off in her bathroom. The impact was so strong enough to give her a huge wound on her right knee. She treated it by herself and did not seek for medical help until 3 weeks later. She really felt sick and did not understand what was happening. He went to see the GP, relayed her story, did some tests, and to her surprise, she was diagnosed to have diabetes mellitus type 2. Mary was dumbfounded and couldn't accept the fact that she got DM type 2. She had a lot of questions in her mind and wished somebody could answer them.
So, what is diabetes mellitus? There are two types, diabetes mellitus type 1 and diabetes mellitus type 2. Diabetes mellitus type 1 is the breaking up of beta cells of the islets of Langerhans. Insulin secretion decreases as beta cell mass declines, making insulin unavailable in maintaining blood glucose level. On the other hand, according to Diabetes Australia, type 2 diabetes is a progressive condition in which the body becomes resistant to the normal effects of insulin and/or gradually loses the capacity to produce enough insulin in the pancreas. Mainly, the problem starts with the pancreas. However, this may also extend to other organs like the kidneys, the liver, the eyes, the peripheries, the heart, the skin, depending on the gravity of the disease. First, we'll look into the pancreas, as this is the main organ involved in diabetes. The pancreas is an organ of the endocrine system and can be found behind the stomach. In the pancreas, you can find little masses of hormone-producing tissues known as the islets of Langerhans, or simply called the pancreatic islets. Here resides two types of islet cells, the alpha cells, which produce glucagon, and the beta cells, which produce insulin. When a person eats a carbohydrate-rich food, this is broken down into glucose. This glucose enters through the bloodstream and should enter the cell to be used as a fuel. In order to do this, the beta cells should secrete insulin to pair up with the glucose molecule and help it enter the cell. Thus, insulin decreases blood glucose level, which is essential for the body to achieve equilibrium. Unfortunately, DM type 2 patients have impaired insulin receptors, which leads to insulin resistance, decreasing the functions of the beta cells. As a result, glucose could not enter the cell and will remain in the bloodstream. This leads to hyperglycemia, or an increased blood glucose level, an indicative sign of diabetes mellitus type 2. In addition, high glucose level in the blood promotes bacterial growth. This impedes blood supply to the tissues, which delays wound healing. As blood glucose levels rise dramatically, it starts to spill in the urine, as it is too much for the kidney tubule cells to absorb. And as the glucose is continually flushed out from the body, water follows, leading to dehydration. This is why, in diabetes, the cardinal signs include 1. Polyuria, excessive urination, 2. Polydipsia, or excessive thirst, and 3. Polyphagia, which is excessive hunger. As mentioned, there will be cellular dehydration in diabetes, and this significantly affects other organs, such as the eyes, which could cause blurry vision or worse, retinopathy, the heart, which could cause ischemic heart disease due to hypoxia, and the peripheral nerves, which contributes to poor tissue perfusion and eventually peripheral neuropathy. In summary, here are the signs and symptoms of DM type 2.
So this is diabetes mellitus type 2. And now, Mary's questions were answered.